So on laboratory findings, you're going to uh, find classic hepatitis B serology markers, and I list some here. And notice how there's a ton of different markers. You have your antibodies here, and you also have these AGs. I'm going to explain what all of these mean so that you'll never miss a hepatitis B serology question again. So all I did is I moved all of those different serology markers to this slide, and I want to break down what all these markers mean because it can be very overwhelming sometimes to see all these different letters and dashes. So how we're going to do this is we're going to take a virus and we're going to give it a core, and we're going to say that this virus has antigens, right? So it has antigens all over it. It could be inside the cell, it could be on the surface, and our body can actually take those antigens and produce antibodies. And so that's the whole point of how we mount an immune response to anything, right? We detect the antigens and we say, oh, these are not antigens that belong to our own body. So I need to mount an antibody to attack those antigens and kill the cell or virus or whatever it is. And so all of these serology markers that you see up here, all of these guys, they are either antigens that are produced by the virus itself, or they're antibodies that are produced by our own immune system to counteract these. So the antigens, you can see anything with an AG here, this is an antigen that's part of the hepatitis virus. And anything with the anti, as we talked about with hepatitis A, is going to show you this anti-HBs, so all these are just different types of antibodies that we can use to determine whether or not our body has encountered one of these or where it is in mounting an immune response if we did get infected. So we'll start with that. So we understand the difference between antigen and antibody. The next thing we have to realize is that there are three different types of antigens. You can see this red, this yellow, and this blue. So there's three different types of antigens we have to know for hepatitis B. There's our surface antigen, which will be denoted with an S. There's our envelope antigen, which you can see here denoted with an E. And then there's a core antigen, which is denoted with this C here. And we have the surface here, this red one. The envelope I'm going to use as this yellow triangle. And the core one will be stuck inside the core. That'll be our blue one. So all I've done now is all 7 of those serology markers that we had labeled up there, I've just categorized them by whether or not it has to do with the surface antigen and the antibody associated with it versus the envelope versus the core. And so now I'm going to draw that classic diagram that you've probably seen in other study aids before, and that's confused you in the past. And let's go over exactly what's happening with each of these antibodies and antigens so we understand it moving forward. So let's start with the surface antigen and antibody. The surface antigen itself is it's gonna be this thing right here. So this gets released from the virus during an active infection. Another thing I want to point out is that when you vaccinate somebody against hepatitis B, the vaccines give this surface antigen directly into your bloodstream. That's all you get is just the surface antigen when you're vaccinated. You don't get the envelope antigen, you don't get the core antigen, and that's going to be important later on when we have to distinguish whether or not somebody had an infection in the past or they were simply vaccinated in the past. We can actually use this idea to determine which one is which. So our HBsAg, that just means our hepatitis B virus surface antigen. If it's positive, you have a current infection. This is only released during acute infection. So if it's ever positive, you have some sort of acute infection. We don't know if it's acute or chronic yet. We just know that there's some sort of infection going on. It could be an acute infection where you have your surface antigen at a short time. So you see how the surface antigen is going up as your virus is replicating, your levels are going up. And if it's an acute infection, that means that our body actually does what it's supposed to do. It creates an antibody. And then once it gets up to the top here, as we create antibodies against this antigen, we start killing off the virus and it starts going down and it's going back to 0. So that would be an acute infection where you have an acute rise in your surface antigen and a decline as we've created antibodies to counteract that. It could also be chronic, though, where you have the surface antigen rise, 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 and we don't mount an adequate response, and we just have this chronic infection where we have some sort of surface antigen being released all the time. Let's talk now. I'm going to put it back to where, as if we had an acute HBV infection, where you have this is our surface antigen. Why this would even go down is because we'd start producing antibodies to that antigen, and that would look something like this, where you have this antibodies finally being detected in our bloodstream. And if you had an acute infection that went away, you'll have some sort of antibodies staying around to make sure that you don't get reinfected. And if you ever have a positive surface antibody, if you have a positive surface antibody, that'll tell us that you have some sort of immunity to HPV. Again, though, we don't know, based on this, we don't know if you're immune because you were infected, you had this acute infection in the past that's gone away, or if you were just vaccinated and given surface antigen that kind of had the same pathway. So just a positive antibody a positive surface antibody tells you you're immune, but we don't know why. To find out why, we're going to ultimately have to use this core antibody later on. So I hope that didn't confuse you too much. I just tried to go over what's going on with the surface antigen and antibody. Now we're going to talk about the envelope antigen and antibody. So starting with the envelope antigen, this gets released during active HPV replication. And I want to distinguish that from an active infection. You can have a hepatitis B infection that's not very infectious, in the sense that it's not actively replicating its genome to try to create more viruses. Sometimes you have an infection that's just kind of reached this nice steady state where it's not actively trying to replicate. So the envelope antigen is more of a marker of how infectious you are, how much active replication the virus is going through. So as I just said, that's probably a better way to put it, is it's an indicator of how transmissible your disease is. So if we look at the antigen directly, if you have a positive envelope antigen, you're highly infectious. So normally during acute infection, you're going to have a time where you're replicating, and then your body will catch up and that infectivity will start to slowly go down. This is ideal in an acute infection. What happens if you have chronic infection, so a chronic surface antigen like this? And keep in mind, if you had chronic, this antibody wouldn't exist on this slide. So if you had a chronic infection, you could still have it to where your hepatitis B virus kind of reaches this steady state and actually does fall down. So this would be an example of chronic hepatitis B with low infectivity. But you could also have it where you have a chronic hepatitis infection that has high infectivity because that envelope antigen stays elevated. And so this is a condition in which you have chronic hep B and your envelope antigen still getting released because your hepatitis B virus in there is actively replicating. So as you can see, in chronic hepatitis B, depending on the envelope antigen status, it'll tell you how infective they are, how transmissible the virus still is. And similar to the surface antibody, we have an envelope antibody that starts to form. And if you have a positive envelope antibody like this, that should give you an idea that you have low infectivity. If you have an antibody against this antigen, these antigen levels will fall, and you should be have a low infectivity with a positive antibody. Let's move on and talk about the core antigen and antibody now. So the core antigen here is, as the name suggests, it's inside the core of hepatitis B, and it's not detectable in the blood. So you're not going to see any release of this core antibody into the bloodstream. And that's different than what we saw with the surface antigen and the envelope. You can see how here we've been able to measure the amount of surface antigen in the blood. And even here, we could measure the amount of envelope antigen. So this core antigen itself is not detectable. So why are we even measuring this? Well, the reason why we care about the core we more care about the core antibody more than anything. So even though we can't detect this core antigen in the blood, our immune system can still interact with this core antigen. It could still get presented on antigen presenting cells, and we can still mount an immune response to this antigen. And we can see that response based on what type of antibody to the core antigen we find, whether it's an IgM or an IgG. So if you have any sort of antibody to the core antigen, that tells you that you were infected with the real hepatitis B virus in the past. We don't know if it's a current infection or a prior, but if you ever see any positive antibody, so it could be the IgM or IgG, that guarantees you were infected with Hep B at some point. Remember when we talked about the vaccination, that was only releasing this surface antigen. So you'll never have any sort of core antibody response with just vaccination. So let's talk about the differences between those two subtypes, those two antibodies to the core antigen. So you can have an IgM antibody or an IgG. And remember when we talked about hepatitis A, an IgM antibody often reflects an acute infection or a very, very recent infection because IgM antibodies have like 10 binding sites. So they're more often used initially. And then as you start to, as your antigens are presented to different cells and you start to produce specific antibodies, you're going to get more IgG antibodies either in the late infection or in a resolved infection. So we'll talk about that now. So let's start with the initial one. So like I just mentioned, if you ever have a core antibody to an IgM antibody, it's going to be related to either an acute infection or a very recent infection. And I'll draw this on the screen right now. So this antibody, this anti-Hep B core IgM is going to be rise up in an acute infection. And as you can see, the levels will start to fall because we're going to end up, instead of producing IgM antibodies, over time, we're going to start producing these IgG antibodies. Now, something they really, really, really love to test, and I rarely make guarantees, but I can almost guarantee that you're going to see some of these questions like this on your shelf exam. They love that for you to know that the anti-Hep B core IgM antibody is the only positive marker during the window period. So what is the window period? So notice in this region right here that I've highlighted that even if you are actively infected, so let's say you had an infection, your Hep B surface, we know our antigens will rise. So you see how this surface antigen rose, our envelope antigen rose, and they all fell down back to here. While at the same time, you can notice that our antibody levels are finally detectable in our blood around this time period, right? So if we measured this area, we'd find that these would be positive. If we measured in this time point, we'd find out that the surface antigen and the envelope antigen are positive. But what if we measured in this area here? You notice how there's a little bit of a gap here. And so this window period is a time in which if you measured the antibodies and antigens to your surface or envelope antibodies or antigens, it's going to show up negative. So it'll show up like you never had an infection at all. But as you can see here in this example, this person for sure had an infection, their antigen levels fell, and their antibodies rose later on. So the reason why this whole anti-Hep B core IgM antibody is so important is because it is the only marker that can give you the idea that this person was actually infected. So it's the only positive marker. If you measure this during the window period, you're going to get a positive anti-Hep B core IgM if they're actually infected. Something I don't know why I'm going to mention this a lot, but I think it's something that maybe traumatized me during my testing time. I had a question that didn't have anti-Hep B core IgM as an option. And what I later learned is that sometimes you can actually get this anti-Hep B envelope that we talked about earlier, this antibody to the envelope protein, sometimes during the window period, this can also be positive. So if you see, I probably shouldn't be even teaching this because it'll just confuse you. I really want to reiterate this anti-Hep B core IgM antibody is going to be your correct answer. Like I said, I think it was like on a step 2 practice problem where I had this one be right. But for the sake of this, we're going to assume anti-Hep B core IgM is your correct answer for the only positive marker during your window period. Let's change gears and talk about the anti-Hep B core IgG antibody. And so this, as we discussed with hepatitis A, is going to be indicative of some sort of resolved infection. Keep in mind, Hep A almost never causes a chronic infection, but Hep B, on the other hand, you're going to see this IgG positive in a chronic infection. So if you ever see this core anti-Hep B core IgG, you have to now think about, is this a chronic infection? Is this a resolved infection? It's one of those two. And we'll draw that in here as well. So now I'm going to take a step back. We've talked about all these different antibodies and antigens, and I've probably confused you quite a bit. What I want to do now is talk about how it's going to present on a clinical vignette and how you can tell the difference between each of these 5 categories. So let's start with an acute infection. So we saw with an acute infection, what happens is that our Hep B surface antigen will rise, and our Hep E antigen, our envelope antigen, also rises. So you can see that these two have already risen. Occasionally, you can even get, you see how this are, of all the antibodies, our anti-Hep B core IgM antibody is the one that rises first, which shouldn't surprise you because we've talked about it many times now that the IgM antibodies are detectable first and then they'll fall. And now these 3 here are likely IgG antibodies, and that's why they're kind of a little bit slow to the game. So in an acute infection, you'll get a positive surface antigen, a positive envelope antigen, and generally speaking, you'll get a positive anti-Hep B core IgM as well. What would happen in a chronic infection? So in a chronic infection, we'd be looking in this area here. And keep in mind, in a chronic infection, you'll still have this surface antigen being produced because you still have an active infection of some sorts. You won't have that, what I did there, just to clarify, you're not having this, you're not mounting a good antibody response. That's why you have this chronic infection. So you usually won't see a significant amount of anti-Hep B surface antigen. And the hepatitis E antigen, we talked about this when we talked about the envelope antigen. So the envelope antigen is a marker of how transmissible your disease is, how much active replication is going on. So you could have a case of chronic hepatitis B like this, where you're very infectious still, you're very transmissible. So in this case, you would have a high envelope antigen. But keep in mind, you might also have a chronic Hep B that's kind of reached that steady state where you're not really actively replicating too much. It's kind of like you've formed this Hep B infection that doesn't really care to replicate. It's kind of happy with where it's at. So you're, for sure, in chronic Hep B, your surface antigen will be positive. But I don't want you to assume that your Hep B envelope antigen has to be positive as well. It might be if it's highly transmissible, but it might not be if it's not. And in this case, because we're so far down in this area here, you will see an anti-Hep B core IgG antibody as well. What are you going to see in the window period? Well, I alluded to that window period being this section here. You're going to see, especially what I want you to pick on tests, I want you to pick this anti-Hep B core IgM. That's almost always the right answer. Like I said, there was one time I had a practice problem that made it to where anti-Hep B, the envelope antibody was actually positive. So if you don't find anti-Hep B core IgM, I guess you could pick this. But like I said, I would just pick the anti-Hep B core IgM if it's provided. So that's the window period. what happens if you have a resolved infection? So you definitely had Hep B in the past and your body cleared it correctly. You don't have any chronic infection. How would we determine that you have some sort of resolved infection? Well, in a resolved infection, we should be looking way over here. We've already mounted our immune response. The antigens have already gone. We've already created our own antibodies to all of those antigens. And now that's the only thing that we would be able to detect in our serum. So we'd be able to find our, you can see here, we'd find our antibody to the surface antigen. We could find an antibody to the envelope antigen. And because it's been so long, we would definitely find an anti-IgG antibody to the core antigen. Remember, our IgM kind of comes up early, but then it'll peter off before we'd even test this. So how would this differ compared to somebody who had a prior vaccination? How do we tell the difference between this and somebody with a prior vaccination? Well, remember with the prior vaccination, that all that did was release a bunch of surface antigen into our bloodstream, and then our body will mount an immune response to that. So what'll happen is that over time, our body will form an antibody to that surface antigen. That makes a lot of sense. But it'll just be this. You're only going to find out that your body, the vaccine produced a lot of this surface antigen, it's cleared off, and you get this antibody response. You will not see any other antibodies. You're not going to see an antibody to the core. You're not going to see an antibody to the envelope because it didn't encounter these antigens. The vaccine only produces this one, whereas the virus will produce all three. So in a vaccination, you're only going to have anti-HBs positive. You're not going to have any core HB core IgG. Contrast that with our resolved infection here, where you will see all of these antibodies present in a resolved infection to true hepatitis B. So here you go. I'll let you look at this in your free time if you'd like. This is where you have, this is just a chart that I've put together to make it easier to understand everything in one slide, especially before test day if you're looking. So I'll leave this here for your review. So, and feel free to go back to this section, obviously, because Hep B serology is very high yield and it can be very confusing at first, but I hope I broke it down in a way that makes some sense to everybody. Thanks for watching. I hope you enjoyed the video. Please like, comment, and subscribe for more content.